We really appreciate all of you coming out tonight because it's a bad night, it's rainy, and it's dreary, and we're so glad we're going to have a spark of hope with Chuck and Janine's presentation. I think you're going to be delighted in hearing from them. Now, my husband is the wit in the group, and he said, Judy, please tell them this before you get real serious about things, so I'm going to tell you what he wrote me out to say. Can you imagine that? Okay. He said, the best thing about Chuck and Janine Phelps is not that they are both doctors. It is not that they are civic leaders in Denison, Texas. It is not that they both sing in the Methodist choir. It is not that they love to boat on Lake Texoma. So to us, the best thing for you to know is that their daughter is married to our son. And we have mutual grandchildren, 2 little girls, and expecting twins, a boy and a girl. So that's all I'm going to say right now, and they're both doctors as well. But tonight, you're not interested in that. You're interested in what they are going to bring to us. And they are great big advocates of international child care, and they're going to explain what all this is. I don't want it to steal their thunder. And Grace Children's Hospital. For the last few years, they've taken 1 or 2 trips to Haiti, the poorest nation in the Western Hemisphere. And they have done remarkable work, not just them, but their whole teams that they bring and other people that go down there in helping prevent disease, help teaching the doctors that are already there, all kinds of wonderful things that they do. And to relieve the suffering of the people in Port-au-Prince, where the Grace Children's Hospital is, and the surrounding areas. And we want to know what we can do to help them bring hope and help as well. So,
I'm going to interject a little bit and keep her under control and on time. And we'll just go from there. So if you have any questions, just raise your hand. I'm not going to raise my hand, but here we go. Thanks for having us, and thanks for the great meal.
Thank you for having us. We appreciate this opportunity. Thank you, Judy and Reagan, for asking us to be here and you guys accepting us. And I tend to get very excited when I start talking about international child health and international child care. So I've already asked Judy to do this, if it's time for me to start wrapping things up. But I grew up actually in Fort Worth and originally Presbyterian Church, so I have real strong ties to the Presbyterian Church, although right now Chuck and I go to the Methodist Church. And the organization we're going to talk about is a Christian, faith-based organization that doesn't have any particular denominational affiliation. But Chuck and I first got involved in international health about, I guess it's been over 25 years ago now. And the reason we decided to do that was that, first of all, we thought it would be an interesting way to learn about a different country, a different culture. It would give us an opportunity to see diseases we don't see very often here in our country, and then possibly provide health care for someone who otherwise would not have any access to health care. But the number one reason we wanted to start getting involved in this is we wanted our children to see how most children in the world live. And so we started taking our children on these trips, short-term volunteer medical activities, mostly in Central America. We went with Feed the Children, with the Methodist Church's Volunteers in Mission, an organization called Medico out of Austin, and all of us had our eyes opened to the terrible healthcare inequities in our world. In fact, when we first came back from Honduras after our first trip, our youngest, Nicholas, was 8 years old. And he said, Mommy, everybody in Denison is rich. And we knew that actually, by our country standards, Denison's relatively poor. I'm a pediatrician. Most of the children in my practice are on Medicaid. But he knew no one in our town was going to go hungry on the streets, that they would be able to find help, and that no one was going to die because of lack of adequate health care. Because anyone could walk into one of our emergency rooms and receive really the best health care in the world. So we kept feeling called back. But I felt like we were really just putting a Band-Aid on a large gaping wound. this, what we ended up calling tailgate medicine, short-term, hands-on, really wasn't addressing the underlying problems. And we longed for an organization that was involved in not just curative care, but preventive health care, that was there all the time for the people, and that was focusing more on empowerment and sustainability. And then we got a call to go to Haiti. A small children's hospital, Grace Children's Hospital in Port-au-Prince, which was known for its TB work, was wanting to broaden its services and be able to provide more different types of health care, and thought maybe U.S. healthcare professionals in the U.S. could help. So we started learning about Haiti. Next. And okay, I think probably after January of 2010, everybody in the world knows where Haiti is. Next. It is on the island of Hispaniola, and it shares the western third with the country of the Dominican Republic. And Haiti is largely French-speaking. It originally was founded by, it was originally founded and inhabited by the Taino Indians, but Christopher Columbus actually landed when he was looking for the New World on the northern coast, and he claimed the island for Spain, and ultimately, because of some disputes in Europe, the western third was given to France. So the Haitians are connected with France, and the Dominican Republic is still connected with Spain. Now this actually shows the deforestation that has occurred in the mountains of Haiti. Haiti was named Haiti by the Taino Indians, which means mountainous, because most of the country is covered by mountains. But the French exported the beautiful mahogany forests and have left the land, unfortunately, at risk for losing its topsoil and flooding. This is downtown Port-au-Prince before the earthquake, before 2010, and that's the great National Palace there in the background, and the statue is Nigmaron. And Nigmaron represents the Haitian slave uprising against the French colonialists. The Taino Indians had originally been enslaved by the French, but when they died off because of the diseases taken in by the French and because of the enslavement, the Africans were brought in to work the fertile lands. And so in 1803, the slaves successfully rose up against the French colonialists and became the first black republic in the New World.
Yeah, this is there, Paul Revere. He's blowing that conch shell, warning his buddies that the French are on the way. It's my favorite statue in the country. Behind it, you'll see the palace, and you'll see the pictures of the palace afterwards, and see the devastation. But it was pretty much leveled. It's since been razed.
And this is the Haitian flag. They basically took the French flag, ripped the white out of it, the white stripe in the middle, and the two remaining stripes represent those of African descent, which make up 95% of the population, and the mulattoes, which are of mixed race. This is a structure that was put up on the 200th anniversary of Haiti. And the Haitians are extremely proud of their heritage. However, because of the fact that as a new black republic in the early 1800s, they were not accepted by the world. They struggled in their first decades of being a young republic. And because of difficult dictatorships, they suffered a terrible brain drain in the mid and late 20th century. Those people who were trying to find employment in the capital ended up being underemployed. And as a result, Haiti, sadly, has been designated as the next.
This is the Haitian Kmart there on the streets there. All those people, they have a certain spot on each they go to every day, and that's their marketplace. And that's where they raise their money to buy food. About 80% of the people every day in Port-au-Prince have to figure out what they're going to eat and where they're going to sleep.
Okay, so Haiti, sadly, has now been designated as the poorest country in the Western Hemisphere with the highest child and infant mortality rate. And the diseases that children suffer with and die with are those that are easily prevented and treated here in our country. diarrheal diseases, respiratory infections, complicated by malnutrition. Now this is the entrance to International Child Care's Grace Children's Hospital before 2010. And the hospital was actually founded in 1967 by a U.S. couple that got off the beaten path back when the cruise ships came into Port-au-Prince, and they were horrified by the number of children dying of tuberculosis in the streets. So they went home, raised money to start a children's hospital. And out of that has grown the larger organization, which is International Child Care. And International Child Care is not made up of just a hospital, but, okay, but, has the slide before that, sorry.
Yeah, we got a blank there.
Okay, that's okay, all right. You can go ahead. Okay, this is the entrance to Grace Children's Hospital. It's actually located in the poorest area of Port-au-Prince, the lower Delma area. And it's really a relative oasis compared to the surrounding slums. And the next slide is the TB sputum area. The leadership there at the hospital found out very quickly if you're going to treat a child for tuberculosis, you're going to have to treat the whole family. And so they have adult and pediatric health services. And you can go ahead and slide. Yeah, just keep clicking on that.
There we go.
All right, pediatric and adult TB clinics. These are the various services that the larger hospital now provides.
It was a premier TB hospital in the Caribbean for many, many years. TB is not quite the problem it was.
And one of the things that really attracted us is the empowerment of the local healthcare community. These are some of the staff there, and ICC takes great pride in its all Haitian staff. This was the original inpatient unit at Grace Children's Hospital. The sickest children were admitted from the clinic into the hospital. Many of them had simple acute illnesses, diarrhea with dehydration, some fevers. Many of them were chronically ill, and the majority of them suffered with malnutrition. And so there was a lot of emphasis has been put on good nutrition at the hospital. Now this little girl, Fabienne, is 18 months old, and she was brought in because she had had fevers and weight loss and a cough for several months. And here is her chest x-ray in the next slide, and Chuck's a radiologist, and he can describe this.
She's sick.
She's sick. Okay, well she has an infiltrate in her right upper lung, and she has tuberculosis. Children with tuberculosis under the age of 5 are at risk for complications, especially if it's been neglected and if they're malnourished. This was a little boy, Frederick, who came in. He was 3 years old, carried in by his father because he had not been able to sit up or walk for 2 weeks. And he has a complication of tuberculosis called Pott's disease, which is a TB infection of the spine.
Why don't you point at it? You want to point at it, show them?
Oh, sorry. Yeah.
TB gets in the
Right
spine
there.
and destroys the vertebral bodies and forms an abscess, and that's that bump you see in his back.
But he was admitted, and he was successfully treated. Sadly, this little girl, Michelle, suffered from TB meningitis, which left her neurologically devastated. And because of the strong association between TB and HIV, a large percentage of the children coming to Grace Children's Hospital also are HIV infected. Many of the children end up having to stay for several months to be treated, and so the school does, the hospital does have a school for the children who are well enough to attend. And I partially put this picture in because there's Nicholas, our younger son. He's the one who said, you know, Mommy, everybody in Denison's rich.
Do the parents stay with them while they're in the hospital?
They have, not 100% of the time, mostly because so many of them have other children at home, they have jobs, and so they have on-site, they call them moms, who take care of the children available. Do the parents stay with the children the whole time that they are in the hospital? And, they are encouraged to be there, but there's not a requirement. But even with just basic IV fluids, medications, good nutrition, most of the children at Grace Children's Hospital got well and went home to healthy and happy with their very pleased parents. And there we go.
There's not an insignificant number of folks that are kids that are just sort of dropped off there and left to be taken care of.
So people ask us, so what is it that you guys would do when you'd go to Haiti? Well, ICC takes great pride in the fact that it does provide education to students, both nursing students and medical students. So our main focus, because we are there to empower the local healthcare system, is to take in educational programming, in addition to raising support here in the U.S. So we've had conferences, bedside consultations at the hospital. This was actually a resuscitation course that we were teaching at the hospital, and some radiology as well. Now, everything changed on January 12th, 2010. The 5-year anniversary of the Haiti earthquake was just a couple of days ago. The epicenter was right outside of Port-au-Prince. And in less than a minute, tens of thousands of people died, were injured, and left homeless. In fact, it was 2 to 3 days before we heard anyone from anyone at Grace Children's Hospital. Finally, the national director got through, said he was alive, but the hospital had been destroyed. One of the staff had died, and one of the children had died in the earthquake. And they said, please, we need help, send help. The staff have taken the children out of the hospital into the yard and are doing the best they can to care for them, but we need help. So Chuck and I put together a team, and we left about 10 days after the earthquake with about a half a ton of medications and supplies. So this is a group of physicians and nurses that we put together. And when we arrived, this is the kind of devastation we started seeing as we came into the edge of the city. And it wasn't difficult to see how it was impossible to get people out and how so many people ended up dying. This is the beautiful National Palace. It was just heartbreaking to see that. And the National Catholic Cathedral. And the next slide is actually the guest house, which was walking distance from the hospital where we used to stay. Fortunately, no one was there and injured. And we went down to the main medical school there in Port-au-Prince, and this actually is the nursing school that had collapsed. And this is some of our team, we were taking some of our supplies over there, and we did not realize that an entire class of young nurses, 90 young women, and their 2 other professors were under the rubble, had died in that collapse. And everywhere were the tent cities, and you saw those on the news. And so Grace has continued to provide services, even though they've had to limit, especially their inpatient unit. The small school has continued to function as well. And so children are continuing to be cared for and are continuing to get well. And the staff who have been very loyal have continued. I wanted to just show you this one little boy because he came in March to the hospital. And he had actually been referred in from an outlying community by the Sisters of Charity mission because he was so malnourished, suffering from chronic diarrhea, and they found out his mother was HIV positive. And they said, you need to go to Grace Children's Hospital. So he sadly was HIV positive too, but he was put on antiretroviral treatment, on appropriate nutrition and other medications, and here he is just about ready to go home. Sadly, his mother did die of her HIV, but he'll be going home with other family members. So this is just a kind of a busy slide, but a quick glimpse at the services that have been ongoing over the few months around summer. Thousands of children have continued to be served. And I like this picture. This is Dr. Bijou hugging one of the patients at the little annual Christmas party they had just last month.
She's our medical director at the hospital.
Yeah, she's the national director there. And we have continued with our educational programs. In fact, I wanted to put this picture in because one of the programs that I have been working in is Helping Babies Breathe, which is a neonatal, have you heard of it? A neonatal resuscitation course for resource-poor areas that has been shown globally to significantly decrease newborn mortality. And we were walking into the hospital, and this woman comes in carrying this baby who's 2 days old, and that is her grandson. She had been trained as a Helping Babies Breathe midwife, basically. And so she had delivered her grandson and was bringing him to Grace Children's Hospital for his first checkup. And then Chuck has done a fantastic job getting the American College of Radiology involved. And I know he wants to say a few
It's a long
words.
story how this happened, but we got in touch with the leadership of American College of Radiology, and we've had three. We've been very fortunate. We got the ACR involved. It's a long story, interesting story, but got them involved. We had 3 educational meetings done in the last 3 years. There's no technology in Haiti, so there were 0 medical students going into radiology. The earthquake happened. We got the ACR involved, and through the education we've been able to provide and the programs, we had 4 sign up 2 years ago. We had 6, so we have a total of 10 young people going into radiology. The whole country has 19 radiologists, so that's a big difference. The ACR has been very helpful for us in that regard.
But Grace Children's Hospital has been the country host for the American College of Radiology and these U.S. radiologists coming in to educate the local physicians and restart a radiology residency program. This was just last March. These are some of the staff from Grace Children's Hospital. And another step in our progress is that we just completed and dedicated in November a new education and training center, which was put in as the second level above those other 2 modules where there have been the outpatient services. And we're very, very proud of this. And Grace Children's Hospital really hopes to become an education center for the country. But our really, really big dream is that on the site of the main campus where the hospital was destroyed, where it's been cleared, that we will be able to raise the monies to build a new Grace Children's Hospital. And the plans have been drawn up, and we are in the process of working towards a capital campaign to raise the money necessary to have a new Grace Children's Hospital. The Ministry of Health says we need it. The local community says we need it. Okay, so a lot of people say, what time is it? Okay, a lot of people say, what can I do? How can I get involved? Well, of course, you can go online and make a donation. You can go online and see what kind of in-kind donations a church might get involved in putting together, like healthy birth kits or hygiene kits for the children that can be shipped in. But visiting the country, visiting the programs is another opportunity I would really like for you guys to consider your church doing. And Mission Education Encounter Team's number 1 goal, objective, is to go and learn. ICC's philosophy is that first, in order to understand, you have to go and learn. Now, every team does have a project. In addition, and if you go on the website and you click on Meet or Mission Education Encounter Team, the poster girl on there is Sarah Jane Phelps Hathcock, my daughter and their daughter-in-law. So that's our daughter, Sarah. She went to Haiti with us on a trip and ended up getting her picture taken with some of the kids, and so the office decided to use it on the website. But this particular group from the U.S. actually helped clear debris at the hospital. And along with clearing the debris, they also hired 3 other people from the neighborhood, 3 Haitians to work along with them. And a day at Grace is another opportunity where the teams going in have a chance to spend a day in the inpatient unit helping to care for the children. This was a team we put together from our community a few years ago. There were some physicians and nurses and a pharmacist, but there were also some business people and a journalist. And we went and visited the programs. This was a little bit more medically focused. This was the last trip we made to Haiti. And there's our daughter, Sarah, again. And there I am, and Chuck. But that was all physicians and nurses. We went to one of the ICC-supported rural clinics in northern Haiti, and we worked there for a week. And you can just go through those slides real quickly. And we just saw the children and had some fun with them as well. So, and then just to wrap this up real quickly, another opportunity that I would like to present to you is a fundraiser that Chuck and I started some years back. I guess it's been about seven or 8 years ago now. And we put together a bicycle team, the Race for Grace team. And we ride in the Hotter and Hell 100, which is in Wichita Falls at the end of August, and raise money for international child care through sponsorships. And let's see, Mr. Joe Stinger, would you stand up? We have one of our cyclists right here. And you can keep going through, you can keep, woo! And you can go, anyway, these are some of my associates, some of the physicians in my practice, and we all wore Grace Children's Hospital jerseys, but there are several.
There are no excuses. We have an 83-year-old nurse, weighs about 180, has had bilateral breast cancer. She rides with us every year. She does it 25.
You don't have to ride 100 miles.
No, she does 25. It's more of
It's not how far you ride or how fast you ride, it's how much support you raise for the kids. But they're just, yeah, that's it. One of the break stops at the Hotter and Hell. Oh, and this, our national director sent me this last spring and said he was going out he lives in Michigan. He was going out for a training ride. Okay, here's our team from year before last. There's Joe. And then this is some of the people from last year. But we've had like 60 to 70 riders the last couple of years.
Raised about $70,000 each year.
Yeah. So, and then you want to mention your...
Okay, if you don't want to ride a bike but you like hunting, we have a preserve hunt out north of Paris, Texas. We do twice a year. It's for pheasant, quail, and chukar. It's a weekend hunt. Very nice young family that runs this preserve, and we've had 2 benefit hunts out there. So if you would like to hunt pheasant, quail, or chukar, or know if somebody in your family likes to hunt, give me a call and we'll get you signed up. It's a fabulous hunt and raises money for the hospital as well. It'll be our 4th year next year.
But anyway, all of this is going towards our vision for ICC. You know, this is our vision statement: health and wholeness in mind, body, and spirit for children and families in empowered communities. And, you know, this is the kind of face we want to see leaving that hospital. Yeah. And I would encourage all of you to look at our website. You know, if you want to learn more about the Race for Grace team or Chuck's, you know, the hunt, or just about the programs and how to put a meet together. Or volunteer in some other way, or just to check on the progress of the organization, we would encourage you to. And so, thank you very much. And in closing, I put some of my cards out there. If anyone would like to pick up the card, my other relationship with the organization is I am an ICC USA board member of the board of directors, and we will actually be meeting in Fort Worth the first weekend in February. We meet in different areas around the country because the board members are from around the country.
I want to congratulate Reverend Kate. It sounds like she's adopted or come into a church that is mission-oriented with the programs that you had, and it's been my experience. It's been a few years as a Methodist, starting Lutheran. It's mission that makes things work, and I'm excited for you in the church. We likewise we're Waples Methodist. I can't compete with I guess a reformed gangster. I've been a friend of Bill Wilson's for a long time. If you know what that means, then you know what that is all about. But thanks again for having us. It's great. I think we have some questions. Time for questions now, is that?
Okay, and I don't mind repeating the question too.
Yeah, but Janine, how good is the medical school that you mentioned?
The medical school actually is fairly good, and Chuck and I can speak from personal experience because, well, first of all, we've worked with some of the students, But we've actually hosted a couple of the students or residents who came to the U.S. and worked with us. And so their book knowledge is excellent, but they just don't have any access to some of the technical equipment, I guess you would say, that we have here. But the basics are very good. But most of them end up having to leave the country to get any kind of specialty training. And unfortunately, many of them don't come back because it's so difficult to make a living as a physician or really as a nurse in Haiti. I mean, the pediatricians at Grace Children's Hospital make $13,000 a year. And I think now to really retain, you've got to go up to $18,000 a year. So most of them have to have a private practice, you know, before and after they work at the hospital in order to make ends meet. So.
The people in Haiti are so fiscally poor, but so spiritually rich. It's really a pleasure to be around. They were inspiring folks. I mean, we warn the people who take to Haiti with us that once you get to Haiti, Haiti will be perfect. It's great people.
There are some brochures on the back, some of you picked them up on the way in, and it tells specific things like what we could put together in little packets to send to them if you ever wanted to. And all the information about where to send it are all in that packet. So, yeah, that's it right there. And it tells stuff about how to know.
Yeah.
Any other questions?
I don't have a question, but I just wanted to say, last month our two granddaughters were here from New Jersey and Pennsylvania, and we went to a Methodist church in Dallas, and all day they had teams. We were there for 2 hours. There were 152 people in our group, and we packed food. It was vitamins, soy, vegetables, and I forget, rice was the last thing. But we packed enough in 2 hours to feed 111 children for a year, and it was going to Haiti to help. When I see these kids, how thin they are, that is so important.
Yeah, and
God
I
bless
can
you
tell you
for
some more
what you
stories about feeding programs they have there, but yeah, that's neat.
My starving children.
Oh, okay, I think I've heard of them. That's wonderful. Yeah. Somebody else had their hand up back here.
Is there really hope for the country to finally pull themselves out of all this money?
I would say yes. There are many who say no. I mean, that the country is destroyed, it's hopeless. And maybe it's just because we've been there, and I've seen the people and their strength, and they're not going to give up. I mean, they are not going to give up, and there's hope. So, and the international community is doing what they can, you know, to help them build economically. So, more children are in school now than they were in school 10 years ago. So, it's not fast enough, but it is. I think there is hope. So. The government's stable right now. You know, they have a president who's fair. He was actually a rock star before he ran for president. Yeah, they called him Sweet Mickey, but he's now President Martelli. And I heard him speak on YouTube or something, and he actually sounded pretty with it. So I haven't heard too much, but there's never enough. I mean, there's never enough. Yes.
Harry said for me to mention, this is my daughter Susan, and she is leaving next Thursday for Haiti on a medical mission with a church out of Denver. So he wanted her to say what she's doing, and she doesn't really know, but she has a bad foot, a fractured foot, but she's going anyway.
And I hope that your team will go, if you go through Port-au-Prince, go to Delma 31 and visit Grace Children's Hospital. They'd love to give you a tour.
I'm sure I'll do that. I'll make it a point to do that. It's my first mission trip. I've never been on one before, and I think they can hear me. And you can't hear me? Okay. Anyway, I'm really looking forward to it, and I did break my foot on November the 9th.
Aww.
And as it is a medical dental trip, because I do dental for a living, I kind of had told them I really don't want to do dental the whole time I'm there because I want to not feel like I'm at work. I want to really interact with the people more. So I had chosen a ministry where we deal with the amputees and the handicapped people. And when I was so depressed with my foot not being able to walk because I was 9 weeks down, and God just, it hit me. God just brought it to me that I was learning the obstacles that I was going to talk to them about. So it's kind of been an interesting journey these past few weeks, getting ready and preparing, but I'm excited. And this even brings more excitement, so
Well,
thank you.
You'll have
Thank you
to
for
give
coming.
Judy and Reagan some feedback, and they can give it to us.
I'll do that.
on
I'll
how-
do that.
yeah,
I'm really
things-
looking forward to it. So
Yeah.
thank you for
Well,
your
best of luck.
presentation. This was great.
Anyone else?
I'm always thinking about money. And I'm just wondering, what is the annual cost of run this kind of an operation?
The annual cost to run it, ooh, great. Let's see if I can, wow. I may have to get back with you on that, but let me, okay, I can, just a second, let me do a little bit of math in my head. Okay. Probably around, actually, not $800,000.
The yearly budget to run the hospital proposes a $20 million project.
The original.
Right. And that time, when all the international money was in a fund in Haiti, it sort of disappeared. And so we're going to try to rebuild the hospital incrementally, and a $3 million package, if you would. The operational expense of the hospital, once it's open and the whole operation, will be probably 1.5. But this organization takes care of the QP in 2/3 of the country, and as far as monitoring and the local care. They do, we didn't talk much about what we do in the Dominican Republic, but we do development and micro-industries and developmental therapy.
Community-based rehabilitation programs for children and basic medical. Yeah, there's another whole program in the Dominican Republic that.
Education is big, and education is big. Haitians would much rather you come into the community, go to their house, have lunch or dinner with them, and meet them, than give them a bottle of advice and send them home. And that's the approach I see it.
The other thing about Grace Children's Hospital is it's not just the inpatient unit and outpatient facilities, but it's the hub for all of their other clinics. You know, I mentioned that one rural clinic, but they have a series of clinics throughout the country they help support. So that, and I'm not sure, their budget would be a little different. But I would say, you know, maybe $600,000 to run the hospital on a regular basis. Well,
I have a question.
Yeah.
How much would it cost for the kids who came to the hospital and were there for a month? Or, I mean, how do they pay for it? Or is it comparable to like if I took my child to the hospital and they were there for a month?
it's I guess basically you'd say sliding scale. They do have small fees for everything because they feel like that at least adds value, and it also is important for helping to keep the hospital running. But no one is turned away because they cannot pay. One advantage of being an inpatient at Grace Children's Hospital is when you're admitted to the the government hospital, your family is required to bring in your food, medications that are required, IV fluids that are required. They'll give you a bed and they'll have the doctors and nurses check on you, but you've got to pay for the supplies. But once a child is admitted to Grace Children's Hospital, everything is provided. So.
There's always a big debate in NGOs, do you charge everything for free, or do you ask people to be a little bit responsible? We think that a little bit of responsibility goes a long way, and people participate in other lines, and when you pay for something, you appreciate that. There's always a scale, it's everything's free, and everything is a higher fee for service. We will also work with Partners in Health and Maryland, do some imaging for them. They can pay $3 and they get health care for the rest of their life. But that feature's not going to last forever. We're going to have to redo that because it's just not financially feasible. So it's a different, economics is difficult in a country like this. But I think the ICC sort of tries to make people as comfortable as they can be and take care of those they can.
And just to go back to the finance question again, ICC USA is just one of the funders for ICC Haiti. They also get grants from the CDC, USAID. In fact, well, that education center was paid for by the U.S. Agency for International Development through a grant that the U.S. applied for. But UNICEF, so they have other funders too. ICC USA, the monies that they provide largely come from individuals, from churches, with some grants, such as the USAID grant but I'll try to get you a more exact figure than my estimate. So, but it's relatively cheap health care.
Yeah, thank you all so much for having us. We really appreciate it.
Yeah, thank you. Thank you, Judy and Reagan. And thank you for your attention. But I would encourage you to go on the website and take a look at things.
Jesus loves the little children, all the children of the world. Red and yellow, black and white, they are precious in His sight. Jesus loves the little children of the world.
The Holy Scriptures speak of God's love for His children and of His desire to provide for their daily needs. In families all around the world, parents want to provide for their children and give them a life that has hope and a good future. In Haiti and the Dominican Republic, most families struggle to survive from day to day. The people work hard to provide basic necessities, often against a backdrop of political turmoil and economic uncertainty. Whether they lived in crowded cities or in remote villages, parents dream of a better life for their children. But for them, a better life means simple things: clean water to drink, enough food to eat, sanitary living conditions, and access to basic health care. In most places, electricity and indoor plumbing are non-existent. Doing the laundry requires a long walk to a riverbank, where rocks serve as washboards. Buildings must be constructed by hand, yet the people manage. They make do, and with a little help, they press forward. Since 1967, international child care has extended a helping hand to thousands of children and families in Haiti and the Dominican Republic. Its mission calls for sustainable empowerment, which means long-term commitment in support of local, hands-on involvement by the people themselves. ICC programs address the basic causes of sickness and suffering. ICC workers travel to homes and community centers to promote health and wholeness. At Grace Children's Hospital, patients receive treatment for tuberculosis, AIDS, and other life-threatening diseases. Treatments are provided regardless of a person's ability to pay. These vital services are made possible through the donations of ICC partners in the United States and Canada. People just like you who are moved to love their neighbors in a tangible way. What do you see in the faces of these children? Can you see them as God does? Can you reach across the miles and respond to their need? Your prayers and support can make the difference between life and death. The difference between barely subsisting or having the abundant life that God promises. Search your heart. Share what you can.